Hello, everyone. Good afternoon to those of you on the East Coast. Good morning to those of you towards the West. My name is Amy Herrera. I'm a special agent with the FBI's Washington, D.C. field office, here to go over a handful of administrative items before we get into the content of today's webinar about securing the health sector. So first off, if you have questions, you are welcome to put your questions in that question box anytime you'd like. We will get to your questions as we go along. We ask for your patience because there are several hundred of you and not very many of us that are monitoring the questions. So bear with us, and thanks in advance for your patience. Second administrative item, we are recording the webinar today. You'll be able to find this webinar in two different places. One of them is the InfraGard portal for InfraGard members. It does take us about a week to get those webinar recordings uploaded. So appreciate your patience again. The webinar will also be archived to an HHS public-facing page. And I know that our partners from HHS will give you a bit more description about where to find that information. Third issue, for administrative purposes, we do have 5 different handouts today that are available in the handout box. You are welcome to download those and go through those along with the speakers. 2 of the handouts are the speaker slides that we'll be using today. So please do take advantage of that. If your system doesn't allow you to download the handouts, not to worry. We will post the handouts next to the recordings of the webinars, so you will be able to snag them later after the fact. Fourth and final admin issue before I turn the mic over to our MC for the day is that if you are attending today to earn some continuing education credits, you will receive an email tomorrow, automated, from the GoToWebinar system that verifies your attendance and comes even with a fancy certificate. So do keep your eyes peeled for that email to arrive in your inbox tomorrow. Without any further ado, I am quite happy to hand the microphone over to Laura Wolf, who comes from the U.S. Department of Health and Human Services. So Laura, over to you for the intro.
Thanks, Amy. So good afternoon or good morning, everyone. I'm the Director of the Division of Critical Infrastructure Protection in the Office of the Assistant Secretary for Preparedness and Response at HHS. I want to thank Amy and our colleagues from InfraGard NCR, along with our DHS CISA colleagues who are co-hosts for this webinar series. This is the second webinar in this series. Last week, we talked about an overview of threats to healthcare facilities and some regional resources with the DHS Protective Security Advisors. This webinar series was kicked off because of the changing threat due to the COVID response and the importance of the healthcare and public health sector in that response. So as we move through the following weeks, we're hoping to provide resources not only for healthcare and patient care partners, but for public health, the research community, and the manufacturing community, all with different unique challenges during COVID response. So last week's response to our webinar was overwhelming, and I think we have at least enough suggestions for 2 months of content for weekly webinars. So thank you for that. As Amy mentioned, we will be posting the recordings on our critical infrastructure page that's found at phe.gov/CIP. Last week's is not quite up yet, as we're learning how to go about processing the videos in a 508 compliant manner, but they will be, and we'll announce that as soon as we can. Today, we have 2 speakers for you. The main presentation is from our DHS Office of Bombing Prevention about preventing IEDs in healthcare. But before we get to that, we want to highlight one of the opportunities for collaboration that we have in the healthcare community to come together during responses and get some of our questions answered and our problems solved. So today we have Ron Robbins from FEMA's National Business Emergency Operations Center to speak to us first. Now, Ron is a great partner to healthcare. He and I have collaborated since the 2017 hurricane season, and we've collaborated on every response since. Part of the uniqueness of this partnership is being able to be tied in directly with FEMA and all of their resources and opportunities during a response. So obviously Ron is currently engaged in the response, and he's joining us from the National Response Coordination Center floor today at FEMA. Hopefully we'll be able to hear him over the din of productivity that's happening there, but excited to hear from him and make sure that you're all aware of the opportunities of the NBEOC before we go to our bombing prevention speaker. So Ron, please go ahead.
And actually, Laura, we're going to change things up because we're kind of dancing on the head of a pin. So I think because of the noise factor, Ron thinks the noise might be done if we let our second speaker, Doug, go first. So I'm going to change things up and say instead we're going to hear from Doug Delancey, who hails from the U.S. Department of Homeland Security, the Cyber Security and Infrastructure Security Agency. He's actually the lead when it comes to putting together the strategy for countering improvised explosive devices, otherwise known as bombs. He has some great experience in this arena. He's been with DHS in that position now for several years, and before that, he dealt with bombs all the time as a military officer who served in Afghanistan, among other places. So thanks everyone for flexibility. It certainly is a handy tool these days. And Doug, without further ado, I'm going to turn the mic over to you. Please go right on ahead.
That sounds great. Thank you very much for that introduction. I hope everybody's doing well today, whether you're on the East Coast and it's afternoon or farther out west where it's still morning. We are going to jump right into it. So today I'm going to provide a quick overview of our organization so we can figure out ways that we can assist you. Also, we'll take a look at the threat landscape, particularly for healthcare and what we've seen recently. I'll show you a great product that you can use called our Security and Resiliency Guide that we've developed for healthcare stakeholders and annex for stakeholders within your field. And then we'll take a look at some of our additional programs and services, and we'll take a few questions after that. First, we'll start by looking at where our agency fits within DHS, so you can gain an additional understanding of other ways that DHS can assist with making your facilities more secure. The Office for Bombing Prevention is part of the DHS Cyber and Infrastructure Security Agency, and that's your nation's risk advisor that focuses on securing critical infrastructure and enhancing preparedness of communities. And if you can look around the wheel in the middle of the slide, you'll see that CISA engages stakeholders from everything involving network defense, cyber activities, infrastructure security, such as what we'll talk about today, and also emergency communication. So first of all, what does our office do and how are we arranged? We'll kind of go into a little deeper dive into some specific resources I think are especially useful for you. But you know, if you look at kind of some of our offerings and the way we're organized, we've got training. We have a lot of information sharing type resources. We'll talk about those. We conduct assessments, workshops, and then we also do the national policy for countering IEDs, working with the Joint Program Office and interagency activities involving that. So who does our office work with? Well, for starters, everybody out there that is logged in today. So we work, do quite a lot of activities with emergency services sector, healthcare and public health, everything from religious institutions, community centers, all forms of commercial facilities, the general traveling public, education, and kind of the policy realm also. So we're spread out in kind of a neat fashion because we are an office that has the ability to influence activities at the you know, the strategic level, the policy level, all the way down to individual citizens and increasing their awareness of the threat and what they can do, how they can protect themselves and make themselves more safe. So what is an improvised explosive device? Sometimes referred to as a homemade bomb. The technical definition's on the slide there, but any device that's placed or fabricated in an improvised manner incorporating destructive, lethal, noxious, pyrotechnic, or incendiary chemicals, kind of a long-winded definition there. If you look at the diagrams on the left and you ask yourself, well, which one of these could be an improvised explosive device? Certainly any one of those. Backpacks were used in the 2005 London subway bombs. Coffee cups have been used in a 2007 Las Vegas incident. Soda can bomb was used in a polling place in Arkansas a few years back. Briefcases have been used, and if you're in the kind of the security area, that's probably not too much of a surprise to you. Common components of an IED are on the right. Typically consists of some type of a switch, an initiator, a main charge, the explosive, a power source, and a container, whether it's some of the containers you may see on the left there, or everything up to a vehicle can be used as a improvised explosive device. And recently we had the 25th anniversary of the Oklahoma City bombing, so just a reminder there. From here, we kind of want to shift directly into healthcare. So we have an open source team that collects information, and we wanted to take a look at domestic healthcare IED incidents. This was pulled from starting as far back as January 2017 all the way through 13 March. Won't necessarily match law enforcement data, as this is all open source, all information that that can be shared. And you can see how these incidents have broken down both regionally in the chart on the right, and you see that somewhere between 171 bomb threats, quite a few suspicious packages, and what we've seen is that within the healthcare sector, a greater proportion of bomb threat incidents. So and that's some tough competition there. Schools get a lot of bomb threats, so to see that there's a higher incidence of bomb threats in the healthcare sector is of note and is important for us to know. Recently, there was a thwarted domestic violent extremist plot. 36-year-old suspect died in March in a firefight. It was occurred during kind of a long-running domestic terrorist investigation that began with some encrypted communications with an individual who's currently in prison now for distributing bomb-making information through social media. The individual considered attacking the University of Kansas hospital before deciding to park a vehicle loaded with explosives and detonate it in front of the parking lot at the Belton Regional Medical Center. Ultimately, this could have been a pretty horrible incident. Luckily, that it was stopped before there was any damage. So let's kind of step back a look at other threats that we've seen against the healthcare infrastructure. Quite a few recent bomb threats. Daytona Beach had a recent bomb threat in March. Murray, Utah, at the Intermountain Medical Center. New Rochelle, New York, an individual, just called in a threat saying he was going to blow up a building with everyone inside. Potential ramming attack in Los Angeles in March. Individual ran a train at full speed. Was driving a vehicle in an attempt to potentially conduct an attack. So quite a few incidents recently, and if we look at some of the really larger concerns, trying to just draw some quick conclusions, and we've got a team that helps us do this. As you can see, well, many public places are less crowded. Healthcare facilities are a little more crowded now, obviously, with the current situation, and therefore may be more attractive targets. Social distancing potentially could increase the risk of homegrown radicalization. And we've also seen some extremist propaganda that's encouraging individuals to weaponize their own illnesses that could potentially contribute to an increase in the demand for healthcare resources. Not long ago, actually about a week ago, our agency, the FBI and HHS, published a joint bulletin, and we've included that in the handouts. This has some web-based entry points for seeking security assistance and access to quite a few additional resources. So I'd encourage you to pull that down and take a look at it, take a look at those resources and see how they can help you. Next, we'll take a look at what we've called our Security and Resiliency Guide. And our Security and Resiliency Guide that you can download at our website is really a foundational resource that can help you build counter IED activities. That can help you prepare for, preventing and preparing for and also mitigating counter IED activities. It contains a set of goals that we use to help you plan and implement counter IED activity, and you can take these goals and roll those into your overall emergency approach. And through these goals, our ultimate end state is really driving down that risk of an improvised explosive device attack. All these goals are aligned within the National Preparedness System, and we'll take a quick look at the structure of this document. We've got for each one of these goals a set of case studies, recommended actions. It links back to resources that you can use, and additionally, really lays out some of the potential consequences, give you a better idea of the threat. We took this document and we developed a set of annexes, and among those annexes was our most recently published annex that we did with the assistance of quite a few healthcare stakeholders, including Dr. Earl Motzler, is the chair of the Healthcare and Public Health Sector Coordinating Council for many years. He helped us really reach a lot of the stakeholders that have some of the best practices. We conducted some site visits, try to determine what might be some potential scenarios that hospitals could face, and then we invited in a set of stakeholders to do a one-day workshop where we ran through these capabilities. So I share that just to kind of describe how we developed this and how we developed it in conjunction with healthcare and public health stakeholders. So we wanted to get this about right, and we published this I guess about a year ago now, certainly pre-COVID, but we think it's a valuable resource, and we've had some good feedback from that. One of the portions of this document, and again, this annex is available as one of the downloads, one of the handouts within our discussion today. We have a diagram of what could be considered a typical hospital. So we identified through working with healthcare stakeholders 7 major areas of consideration to include considerations for the security office, clinical areas, parking areas, loading docks, emergency department services, ambulance bay. I think the last was powertrain, utility station. For each one of these, we developed kind of a set of best practices or considerations that you can use for increasing your security. And while what my discussion today is centered on homemade bombs, on improvised explosive devices, really all the security measures within this particular annex are pretty valuable for whether it's active shooter or other security concerns. I'd like to go a little bit into some of the additional resources that we have in our office. We're not going to talk about all of these today. We'll focus on a couple, but at the end of the presentation today, I'm going to invite you to connect with us through either our website or my email or our office email, so that you can reach back into any of our programs that you may have interest in. One of which it's really particularly useful for information sharing is what we call the technical resource for incident prevention, Tripwire. It's a website. It shares resources, information, tools from federal, state, local, state partners, and through gaining an account there, you can access recent activity, both incidents and also different profiles based on other concerns that you may have about improvised explosive devices. So I'd encourage you, if you're kind of at the security manager level or at a level where you need and want access into current information, I'd encourage you to go to tripwire.dhs.gov. Again, our contact information will be at the end there, but this is a great way to increase awareness of both evolving IED tactics, techniques, and an opportunity to share lessons learned. We also have a lot of training that is especially useful in this time, because we have our training spread out through in-person, virtual, instructor-led training, and also self-paced, computer-based training. And our training's certified, accredited by the ISAT, International Association for Continuing Education and Training. And we'll take a look at some of the specific courses on the next slide here. And our in-person training, we have mobile training teams that go around the country and conduct these trainings. Obviously, they're not traveling now for that, but our virtual instructor-led training is available. And we train several hundred people throughout every week, everything from IED construction classification to introduction to the terrorist attack cycle, response to suspicious behaviors, and protective measure awareness. When you go to our website, you can see the actual courses that are available and the times, and when you apply for those courses and you just need a FEMA student ID number, which takes about 60 seconds, you're able to have that training conducted for you in a small group, and it's done by an accredited instructor, and you have the opportunity to ask questions and gain accredited training. So that's something pretty useful in this particular time. We've seen quite a spike in those offerings in the last few weeks, and we'd expect that to continue. Additionally, we have quite a few awareness products, and those are all available at our website. You can download those. We have everything from posters to informational videos. We'll talk specifically about 3 new videos that we have that you can take a look at. We have bomb threat guidance products. We've included the bomb threat guidance trifold within the handouts for the discussion today, and that's kind of a great one-stop shop to both connect back to our office, also understand what to do in a bomb threat scenario. We have protection guides, awareness cards, and everything from all the way down to like individual lanyard cards that your security personnel can download and use. A recent thing that we've published and put on our website is an awareness card that can help make the determination between whether or not an item is suspicious or most likely just unattended. It also gives some guidance for what to do when you've got a suspicious item, and describes how you should recognize the indicators, avoid the area, isolate, keep other people away, and notify emergency services. So that's one of the products that we have. Additionally, we've released recently 3 new videos, and these videos are available on the Cyber and Infrastructure Security Agency YouTube channel. We've got one that goes into some pretty good detail about making that determination between if an item is potentially just unattended or if it's suspicious and what to do. We have an additional video about conducting a bomb search. A lot of people think that if you have a bomb threat that you call that into the first responders, and first responders, law enforcement come, or bomb techs, and search your facility. Doesn't really work that way, because they don't know the landscape, they don't know your facility. So it talks through how if you do receive a bomb threat and you believe there's some credibility and you want to conduct a search, how you go about doing that. Additionally, we have a video on surviving a bomb attack, and that's something that we haven't really seen anybody produce before, and it has some considerations if you find yourself in that situation, some things to think about and what to do. In a moment, we'll open it up for any questions. There's a couple emails there. One is our office email, obp@cisa.dhs.gov. That is our office email that can help you connect back to any of the resources that you're interested in, or anything that potentially we can help you with. My email is on there also. We can also assist you in linking up with your protective security advisor. I know last week you had a briefing on what the protective security advisor can do for you. If you're not sure who your protective security advisor is, we'd be happy to link you up with yours. And a second, we'll open it up for any potential questions. I lead one of the branches in our office, so I'm not an expert about every program that we have. But again, I'd encourage you as healthcare stakeholders to download that Security and Resiliency Guide Annex for healthcare stakeholders. I think that's really a great product that you can use. It can serve as an entry point into understanding the threat of a homemade bomb, an improvised explosive device, and what actions you can take to make your facility more safe. And that's it for me in about 20 minutes.
Well done, Doug. Wow, that was a ton of information in 20 minutes. We did get some interesting questions from some of our attendees, so I'm going to toss those your way. Easy one coming first. Would OBP, the Office of Bombing Prevention, assist local jurisdictions directly with various discussion-based or operational-based exercises, or would those local jurisdictions instead be referred to FEMA's exercise division?
Okay, sure. We do have a workshop program. So we do conduct workshops around the country, and those start out by, if we have a jurisdiction that's interested, they would, request that training workshop through their protective security advisor, and we would work with them to develop a scenario. If we're able to get them into the schedule, develop a scenario that considers their concerns. We do what's called a first responder workshop. We come back and do a bomb squad SWAT interoperability workshop, and then later an executive out brief of the results that can help stakeholders close gaps. We call that the multi-jurisdictional security planning workshop. So if someone's interested in potentially doing that, please contact our office and we'll loop in your protective security advisor and see if that makes sense.
Thank you for that. Next question is much broader for you. Can you speak for a bit about the motivations for these attacks? Why do people do this? Why would someone even decide to change their targets from one hospital to another? Do you have any thoughts to share about motivations behind these attacks?
Sure, I can give that a shot. Might be a little out of my scope. What we see, and if you think back to the high-profile bombing incidents in the last few years, you can look at everything from, isolated, Ted Kaczynski, in a cabin. Some people are just motivated, it seems, by, the thrill, or it's a hobby. Certainly you've got transnational terrorism that is probably the most prevalent. Domestic terrorism. If you think about Timothy McVeigh and the Oklahoma City bombing 25 years ago, nearly to the day. Transnational crime, sometimes it fits in there too. So I guess the answer, at least from my perspective, is it's really all over the place. And I guess from the perspective of a stakeholder, being a security manager or an owner operator, I'm not sure the motive always matters so much, but it does kind of help think through where your threats may come from. That's one reason why understanding the generic attack cycle can be useful, in that with any of those groups that I mentioned, if you take a look at the high profile incidents, most of those involve some type of surveillance prior to the attack. So that's why we really encourage stakeholders to either take our counter surveillance detection course, or to just put into place alert personnel that are looking for somebody that might be conducting surveillance, trying to figure out how to conduct an attack and what their approach might be.
Makes perfect sense, right? It's always trying to find those indicators prior to the attack so we can interrupt things before anything goes boom. A couple more tactical questions that have come in here. One of them comes from Children's Hospital out of Philadelphia. So hello to those good folks. They're starting to implement bleeding control kits throughout their campus. Do you have any recommendations on how many kits a hospital should have, and maybe key locations where to put those kits in case of a bombing event?
No, nothing specific on that. Any type of medical advice, of course, is really way out of our purview. What I would encourage healthcare stakeholders to do, though, is to download the annex that I mentioned, because we do have there key considerations for making different areas of a hospital more secure. So I think if I was approaching the problem from the medical aspect, I would take a look at that, and I would use those best practices for the different locations, and I would make a risk determination based on adapting my facility to that generic diagram, and try to think through where I'd be more concerned about an attack, and where an attack potentially could have larger consequences in terms of casualties, and make the decision based on that.
Got it. That makes perfect sense. And another more specific question for you deals with facilities that might have radioactive devices that are on campus there. So the attendee asks, has there been any collaboration or discussion between the Office of Bombing Prevention and Department of Energy's Office of Radiological Security Programs for how to protect healthcare facilities that might have radiological source materials? Like, how would you prevent theft of materials to prevent creation of a radioactive device, right? Or how would you deal with an IED that might get detonated on the campus of a place that has radioactive devices like that? Any thoughts on that?
Sure. A few. So when we started to work with healthcare stakeholders to develop our the annex that I mentioned, we really quickly got a sense for just how complicated the security landscape of healthcare is. One security manager described it as as a hotel for sick people, and of course we started to understand the considerations of how you're likely to you're potentially cause more harm by evacuating facility. And one of the considerations that did come into play in those discussions, of course, is the radiological concern. So within the annex, we developed some kind of heightened awareness considerations for access points, and I think that can be useful. Certainly with everything that we recommend, we're more concerned about really the prevention aspect. Most of what we do is involve trying to prevent or mitigate the effects. So nothing really technical that I can advise, other than just as you make your look at your risk standpoint and your risk landscape, trying to put items in a higher priority where you're trying to reduce access to areas that are potentially more vulnerable, or areas that can have a added effect, such as radiological disbursement.
Got it. And I'm going to toss you one more before we head over to our other guest speaker from FEMA for today. So the one more for you, and then if we have time, we'll address some additional ones towards the end of our hour together today. Have you seen, in terms of threat pictures, have you seen plans for combining a ramming attack, so a vehicle attack, along with an IED, maybe where one part is a distraction and the other part is the actual attack, or vice versa?
Sure.
Any thoughts about that combination?
Sure. So one thing that we've noticed internationally, and if you think back on some of the more prominent ramming attacks, is a lot of those incorporated a hoax suicide vest. So in some cases, and I believe there's been some precedent with extremist literature, Dabiq and Inspire, encouraging attacks that can make the decisions that first responders have to make more difficult. So we have seen some combinations of trying to make an attack more difficult for first responders to deal with. And one example is combining the driver of a ramming attack, where it clearly appears to be that it's suicidal in nature, with a hoax suicide vest. I can't think offhand of any ramming attacks that have included a device in the vehicle that I can think of, but that's definitely something I'll take back to our open source information team, and we'll take a look at that.
Awesome. Thank you so much. And we may have some more questions if we have time for you more towards the end. But without too much further ado, I'd like to flip things back over to Laura Wolf from HHS, who will reintroduce our FEMA guest for today. So Laura, over to you.
Thank you, Amy. And for those who missed the beginning of the call, as this is the second webinar in our series about securing health facilities, we got some feedback after last week about the importance of specific information about security risks, but also a shout out to the collaborative efforts that we have across government to coordinate with private sector partners and among government partners, and how important those relationships are, so that if there are threats or events that we have to respond to, that you have more opportunities to get questions answered and find those resources in real time. So we wanted to feature one of our partners, the FEMA National Business Emergency Operations Center today, which collaborates with private sector through every type of response. And I just want to say that our speaker today, Ron Robbins, has been a great partner to healthcare since we started collaborating with them during the 2017 hurricanes. He is actively engaged in the current COVID response with FEMA and is joining us from the National Response Center, National Response Coordination Center floor. So turning it over to him for a few-minute introduction to this important collaborative opportunity.
Great, thank you. Can you hear me, Laura?
Yes.
Great, thank you. I had to adjust fire again because the meeting was carrying on over, so I didn't think we wanted that bleed over into the call. So I had to jump to the next floor. So thank you for inviting us to the call, and we appreciate the opportunity to talk with everyone today. Just a little background, as Laura mentioned, back in 2017 was our first chance to really kind of get really connected on an operational level with the healthcare folks during the 2017 hurricane season, and to help us to connect better with the healthcare, and obviously to help expand out on the healthcare side some of the operational coordination with private industry. We've also had some great opportunity to work with the folks at HHS and ASPR with regard to some exercises over the past couple years, especially last year with the Crimson Contagion exercise, and obviously now into the COVID-19 pandemic here in 2020. Laura mentioned that we run the NBEOC, and that is part of now what is the Office of Business Industry Infrastructure and Integration, or OB3I. We are in the process of going through a rebrand right now. Our office is co-located, nested within the Logistics Management Directorate at FEMA. And a few of the things we do, I'll just go over and highlight some of our mission, vision, and tenets about what we are and what we do. We obviously help engage, integrate, and operate with the private sector before, during, and after a disaster. With some of the increasing complexities we've seen with disasters recently, and in the landscape and the complexity of the disasters changing, it's important for us to evolve and to be able to respond for better outcomes for survivors and the communities. Some of what we do is we help connect. We help connect the private sector to capabilities. We try to work to transform to how the private sector, public and private partnerships, and collaborate with industry partners regarding shared risks and evolving challenges. And we try to build operational trust with our partners through consistent collaboration, engagement, and integration through exercises and through real-time events. If you see on the slide there, towards the bottom is a diagram of our construct, and it really is kind of split into two parts. The left side of the diagram there is our relationship with our partners at CISA as part of ESF 14, which, for those that aren't familiar with it, the National Response Framework went through an update last year, and with the onset of ESF 14, that is a ESF that is a co-led by partners from CISA and from FEMA. And the diagram you see there, it gives a breakdown of how how the two entities come together. On the left side, you'll see part of the CISA component is the National Resource Management Center, National Response Management Center, CISA, and then of course private industry and ESF partners. These are the PSAs and the regions that was mentioned by our previous speaker. And then on the right side, obviously this is the FEMA side. This is obviously the NBOC there, and then you see OB3I nested in there, and along with public sector and our interagency partners. And to the far right side, there's a few of our products. SCAN, which is a supply chain active network, which is led by Mr. Gene Shear. He is the supply chain advisor for LMD and produces some assessment reports for senior leadership regarding supply chain and some of the activities and assessments of the supply chain during, before, during, and after events. And Pulse is a component that is a collaboration with our partners regarding business and infrastructure, business data to advise and provide our liaisons and industry partners more insight and information regarding the business industry as a whole from a data perspective. Some of our core, I'll give it a little brief about what our core tasks are at the NBOC. Part of what we do is we connect with business and industry to inform and improve their operational resilience. We respond rapidly and accurately as possible to stakeholder questions and concerns during a disaster. And we do this through a mechanism through our NBEOC operations dashboard. Some of you may have seen that, some of you may have not. And when we, at the completion here, for those that don't have the link to our dashboard, I'll share that with everyone. This dashboard is operational 365. We run it even in blue skies just to keep it a warm running place for our partners to engage and interact. Excuse me. And obviously, as we step into disaster operations, the dashboard becomes a central point of access for our industry partners to cross-share information and interact with our industry partners. We provide economic response framing and data to inform decision-making across the operational enterprise, and we support our state and regional operations to enable the private sector both locally and through our state and regional partners. Some of our desired outcomes of the NBOC is to promote effective sequencing of effort based on analysis of system interdependencies for local, state, regional, and national benefits. We want to prevent and mitigate cascading failures across multiple sectors. And we want to increase harmony and coordination between all levels of government and business during cross-sector operations. Also, we look to try to stabilize supply chains and distribution networks, both within and outside affected areas, to promote public health, safety, and reduce economic impacts. And then monitor any degradation of critical infrastructure and supply chains that impact national security and the national economy. And that is kind of a quick rundown of what we do at OB3I and NBEOC. And unfortunately, I'm not in front of my laptop, so I can't tap in there in the chat box to give you the link to our dashboard. But I'll be glad to share that information after the meeting with all the attendees, and feel free to go check it out. And then if you have any questions, we also have a open chat box on that platform, and so you're free to send us questions. Or if you have any questions of us, you can reach us two ways. You can reach directly to our email, which is nbeoc@fema.dhs.gov, or you can send questions to nbeoc max.gov, and we'll get a response back to you. And with that, I'll pause and stand by for questions.
Thanks very much, Ron, for all that information. Super helpful to hear about this collaborative effort that FEMA is leading. For folks who are in attendance, if you have questions for Ron, please go ahead and throw them into the question box and we'll get through them as we can. We do have a couple of extra minutes remaining where we can go back and address some of the questions that pertain to what Doug was talking about. So Doug, this is a heads up for you. There's more questions coming your way.
Sounds good.
All right, one of our folks is referencing some perhaps older information that talked about avoiding radios or avoiding RF devices in the area. Is that still a recommendation? That's a really technical one for you.
Sure, absolutely. When one of the slides I had up described what we use as an acronym that's useful called RAIN, recognize, avoid, isolate, and notify. You'll see in the details of avoiding that, once you recognize that something's potentially an improvised explosive device or a homemade bomb, certainly the last thing you want to do is to use any type of radio, any type of cell phone in proximity to that. In some cases that could detonate a device. So certainly that's highly recommended. You want to immediately avoid the device. Get far away from it. Make sure other people don't go near it, of course, and notify first responders and law enforcement.
Got it. Thank you. The scope of the threat question for you, Doug. Is there a particular region of the country that's experiencing a higher degree of threats than other parts of the country? Do you see any geographic distribution that might be uneven? And if so, any thoughts to why?
Geographically, I'm kind of pulling up the slide that I had up recently. It's always kind of confusing when you look at the regions just because of the population density. I don't have it in front of me, but I know that typically within Region 9, California, we see maybe a little higher percentage of bombing activity, and that includes everything from bomb threats to actual devices, bomb making materials found. But I can't say there's any kind of consistent regional trends that we see. It tends to be a little bit predictable and based primarily upon population density.
That makes sense. And so here's something to really push the envelope forward a bit. One of our attendees has said, look, the bad actors that are out there use all kinds of methods to probe the environment. So some of those methods would be hacking, would be cyber, might be physical visits to the facility, might be open source research. Have you seen any relationship between an increasing number of cyber attacks against a facility linked to a future IED attack? Is there any kind of linkage between those two different threat pieces?
None that I'm aware of. It's something that I could take back to our open source intelligence team, but no type of trends that I'm aware of involving that. I think just based as really what, not my role, but just kind of what I read. I mean, certainly we know there's an increase in the the cyber type activity, whether it's from terrorists or other actors. But I don't know if there's necessarily a correlation between known cyber threats and attacks and actual efforts to use an improvised explosive device.
Thank you for that input. And here we have a question that goes to collaboration with other international agencies that are also interested in this issue. So this attendee says that he toured a hospital in Haifa, Israel, several years ago, that they have an underground bunker with 1,500 beds, and they are evaluating and assessing every incoming vehicle and every incoming patient as a potential terrorist or a potential IED carrier. So is OBP doing any work, or have you done any work to collaborate with the Israeli security forces? And are there particular lessons learned you've been able to share with each other about that?
We've done some international work. We're part of the European Union U.S. Explosive Experts Seminar. We're also part of some soft target, crowded places activities and task force that we provide some assistance with in Canada. We really haven't, I mean, Israel obviously is a much different security landscape. But no, I mean, we do look at overseas trends. We do some collaboration with partners from kind of a broader perspective. But no, we haven't really done a deeper dive into healthcare internationally. I mean, our efforts really are focused kind of more within our scope domestically.
And on the domestic front, we have in attendance some folks not only from the healthcare sector today, but from other sectors as well. So a couple of them have asked, are there specific sorts of trainings for particular sectors? For instance, specific trainings for the transportation sector, particularly for subway systems? Would there be specific trainings for religious institutions that are faith-based places trying to be on the lookout for potential bombs? Do you have any place where you want to point people for those types of resources?
Yeah, I'd say mostly, much of our training is kind of generic. I mean, certainly, there's the opportunity to interact with the instructors and ask questions specific to, the critical infrastructure sector or subsector. But no, nothing really too specific. The Center for Domestic Preparedness has some, more specific by sector training that's a little broader than just bombing. But we do have some courses that tend to be a little more aligned with some sectors. So like we've got a VBID, vehicle-borne improvised explosive device search course. Certainly that's prevalent concern for a lot of areas that have vehicle access. But it doesn't really. A lot of our training isn't kind of too specific within sector, but it does provide. All of our training provides pretty good overall guidance with everything from protective measures and suspicious activity and how to recognize it.
Got it. That makes sense. And here I've got a really technical question for you. If a facility finds some kind of device before law enforcement would arrive, what's the radius to evacuate the area? How far away should you go?
Sure. So we have some, broad guidance. We provide a bomb threat standoff card that's on our website. Something as small as a pipe bomb, we consider to be, typically about 5 pounds of explosive. Good shelter in place guidance is, somewhere, beyond 70 feet. Preferred evacuation distance is 1,200 feet. You always have to consider kind of what's between you and the suspicious device. But if you download that bomb threat standoff card, we've got, kind of ramps up from, pipe bomb all the way to a suicide bomber where, we consider they may have, somewhere upwards to, 20 pounds of explosive capacity. There we look at a mandatory evacuation distance of, at least 110 feet with a preferred evacuation distance of 1,700 feet. But if you download that card or if you reach out to my email or our office email, provides explosive capacity for everything from what I just mentioned, pipe bombs, suicide bombs, all the way up through briefcases, cars, SUVs, different types of delivery type vehicles, and that's available on our website, or you can reach out and we'll provide that to you.
Got it. Thank you. And I have to include one more question just because the folks that submitted this one are specifically noting the importance of public-private partnerships. And I think we're illustrating that in this webinar series. And clearly this attendee is finding the same thing and asks, are there any plans to increase outreach efforts with professional associations like as is to create best practices that are not only effective, but also navigate the sometimes confusing regulatory standards from different agencies? So is OBP working in particular with trade groups and associations for this messaging?
Sure. So, we're on the non-regulatory side, but we do quite a lot of work with trade associations. We do, and it's kind of aligned to the, some of it to the annexes that we've developed. We work with outdoor events, everything from the, International Association of Amusement Parks and Attractions to the BOMA, the Building Operation Managers Association. I could reel off a few, the International Fairs and Expositions and Attractions Trade Association. But what we try very hard to do is when developing any of our training or any of our products and resources is to reach out to those trade associations, reach out to even some of the local associations. As an example, when we developed our first annex for our security and resiliency guide, we did outreach with the Washington DC Hotel Association, and then eventually broaden that to the American Hotel and Lodging Association. And we do that to make sure that both the trainings that we're developing, the products that we're developing or that we think are a good idea, that we're reaching out to those groups, and we're making sure that what we develop is something that's useful. And then we'll tend to establish some champions that'll help us take draft products. Dr. Earl Motzler helped us do that with the healthcare annex. We sent back a draft, and he was able to farm it out to some of his contacts and provide us some really good feedback. And just kind of close the loop of that, take it all the way. Some of the trade associations hang our products on their website. So when we see that, we think that we've gotten it about right. But absolutely, I mean, message received. We definitely, without the inputs of the private sector, our products we don't think would be nearly as well dialed in or received. So we definitely acknowledge that that's important. Additionally, and just kind of lastly, we do targeted outreach through our booth and some of our trained personnel that will booth at selected conventions. You mentioned ASIS. There's several some of the major conventions that we go to, and we interact with stakeholders and make sure that we're receiving what's their needs, and also providing products and services back.
And with that, although we haven't been able to get to everyone's questions, to be mindful of our time constraints, I'm going to turn things back over to Laura Wolf from HHS for a quick wrap-up of today.
Sure, thanks, Amy. And I did note in that the last questioner also flagged another association, had to Google to get the name right, the International Association for Healthcare Security and Safety. My team has been collaborating with them to identify some of the future topic areas for this webinar. So I want to thank them for their partnership, and also note that they'd be a great partner for ongoing resources of navigating regulatory challenges for IED prevention, as was just mentioned. So thanks to that group, thanks to all of our partners. Next week, we are planning to have the topic of active shooter protection and resilience. So please join us again. We'll be sending out the registration information early next week, and hope to see many of you back for week 3. Remember to download the handouts that you're interested in before logging off, and we will let you know as soon as these recordings are posted. But thank you for your participation, and thank you for your work to secure the health sector.
And speaking of the ongoing series, if you have particular topics that would be useful to you to help keep your workplace and yourself safe, please do let us know that. When you leave this webinar, you'll be jumped to a really quick survey. We read every single piece of feedback that we get, and we use that feedback to plan for next series and next additional webinars. So please do be blunt with us in terms of how do we do today? Did we offer you valuable information that you can actually put to good use? And what else do you need to hear about to stay safe in today's environment? Thank you so much to our expert presenters today, both Ron Robbins from FEMA and Doug Delancey from the Office of Bombing Prevention. Really appreciate your help and your support. And until we meet again, we hope to see you next Friday, same time, same place, to talk about active shooters. If not then, at another time. Thanks everybody for attending, and please stay safe. We'll see you soon. Take care.